Meanwhile, tonight, a brand new report from the Department of Public Health looks into dozens of COVID clusters last month.
The report showing restaurants, offices, homes, and child care facilities are the top 4 origin points. But the state and the DPH saying the report won't be impacting policy. Channel 3 Eyewitness News reporter Sharon Johnson is live outside the Department of Public Health lab to explain why. Sharon.
Well, Mark and Aaron, the DPH only investigated 84 COVID clusters. That is a very small percentage as compared to the total amount of outbreaks. They also say that it's challenging to identify outbreak locations as community spread increases.
Anything that strikes fear, and people are making, unfortunately, not even going out. We've seen takeout numbers decline in certain areas. Like, those things worry me.
The executive director of the Connecticut Restaurant Association, Scott Dolch, is reacting to a December COVID cluster report from the Department of Public Health. The report shows out of the 84 clusters the DPH investigated, 21 came from restaurants. With restaurants still struggling and waiting for federal and local aid, Dolch says he needs to see more information.
I want to make sure that we're doing everything that's right, and let's look at the details. But I think that there's still a lot of unanswered questions that came out of that report.
The report investigates COVID clusters ranging from 2 people to 67. Restaurants, offices, homes, and child care facilities were the main settings for the clusters. But the DPH itself says the numbers don't mean they proved transmission happened in those locations. It's also a very small number investigated. By comparison, last month, Massachusetts investigated more than 35,000 clusters, where only 75 were tied back to restaurants. New York State recently investigated 46,000 cases since September, where restaurants accounted for less than 2% of spread, as compared to private gatherings causing 73%.
It's a little dangerous to read too much into that from a policy perspective because they make up a very small percentage of the total.
With the report released on a monthly basis with a small fraction of clusters being investigated, the state says they can't make decisions based off of this data alone.
You have to think very carefully as you look at this data.
And then another important thing to note, this report does not include healthcare settings or higher institution settings. Those institutions track their own numbers. Live in Rocky Hill tonight, Sharon Johnson, Channel 3 Eyewitness News.